Hi, I'm Emma Hallam. I've been asked to put together a short video to talk about the experiences that my son Alex has been having whilst being on a Pfizer clinical trial called myostatin upregulation. He started the trial back in May 2015, and really the reason that we chose this trial and the reason why Alex is on this trial was because we've been looking out for clinical trials to take part in for a number of years now, pretty much ever since Alex was diagnosed. It was really vital for us, both for Alex and as a family really, to get Alex on a clinical trial, because we know that without running clinical trials there's not going to be any treatments available for boys that have got Duchenne muscular dystrophy, and that's just not on. It's just we've got to get new treatments and trials underway to help boys that have got Duchenne. So Alex took part in the Pfizer trial. He started in May last year. We've been going on for about 10 months now, and this is really sort of a short video about the trial, how Alex is getting on and how we're finding it as a family. So every 4 weeks we have to attend Newcastle Hospital. We're normally there for about a day and a half, sometimes it's 2 days, taking part in the various things that we have to do. And so far it's been a really good experience for Alex and myself, because I go along with him. One, it gives us a huge amount of quality time together, and Alex loves it because he gets a day off school, which is great, and I know it gives him a huge amount of hope, knowing that now he's taking part in a trial and that he's doing his bit for the Duchenne community in helping bring about new treatments. So for him, it offers help. It's also an outlay as well. He often talks about Duchenne and the problems that he faces personally, and also his outlook on life. And it just explains, it just gives us that quality time where we can have a chat about Duchenne, really, away from all the other distractions that come about generally in life. So in terms of the actual trial itself, Alex is not struggling at all with taking the drug. He's been absolutely fine. I mean, he's a right little trooper anyway, in that, you know, he attends hospital appointments and he does what he's told, and he's quite happy with that. So he's not found any of it particularly daunting. In fact, he really enjoys it. He enjoys getting away from the house and spending some time in Newcastle. So the clinical trial has been a good experience from our perspective. Have we seen any noticeable difference? It's very difficult to say. It's only been 10 months, and during that time Alex broke his hip. So he broke his hip and had to go into hospital and have an operation, which put him right back to pretty much square one. So therefore it's difficult to say whether or not we've seen any improvement so far, but what we can say is that Alex absolutely got over the hip break so quickly. Within 6 weeks he was back on his feet and able to walk and able to take part in activities that he does at school, sporting and playing around with his friends. So from that perspective, he had a huge, fabulous recovery. We've also noticed as well during the trial period that Alex has been able to hop on his left leg, which he couldn't do before. Not by much, just by a little bit. Now, is that down to the drug? We don't know, because we don't even know if Alex is on the drug. He could well be on the placebo. We're not sure. So we're just going to see how things go for now. But we do know that Alex is doing really well, and is still able to walk quite long distances, take part in all the activities that he does. And bearing in mind that he's going to be 10 in May, you know, we think potentially he could be on the drug and maybe it is working, but we have no evidence of that at this stage. I think it's really crucial that people do take part in clinical trials, and not to be fazed by them, because it's just such a wonderful experience to spend that time with your boy and knowing that you're doing something that hopefully will help all children that have got Duchenne. Bringing about new treatments is only going to happen if we can obviously get boys through on the trials and actually prove whether or not the drugs work. So for us, it's absolutely vital that if you have a child with Duchenne who is eligible to take part in these clinical trials, then, you know, just go and find out what it's about, and just take that leap and do what you can. We have, and you know, it's been a great experience for us. This is a 2-year trial, so we've still got quite a long way to go. But you know, from my perspective, all I can say is taking part in clinical trial is a positive and a good step forward. Alex talks about it regularly to his friends. He, you know, the fact that he's on a clinical trial, the fact that potentially he might be helping bring about a new treatment that can help all children. So I think he sees the good side in, being involved. I certainly do as a parent. It's just great to know that, we're doing our bit really, and we're just going to see how the clinical trial goes from here. And that's it really. It's just my experiences, Alex's experience about being on the trial. The hospital, Newcastle Hospital, have been absolutely fantastic. They have lots of toys and, video games and all sorts of things for Alex to get involved with. So during his time there, he doesn't see it as being a negative experience at all. He really enjoys it. He enjoys getting on the train and going up there, staying overnight in the hotel. It's just an experience for him. So, from our perspective, there's no kind of downsides to it really. It is regular, it is every month, but it's just something that you put in your diary and you just know it's coming, and that's it really. We don't try and worry too much about it. It doesn't really interfere. So all I can say is, if you are looking at clinical trials and if you're looking at the Pfizer clinical trial, then give it a go. There's nothing to lose and hopefully lots to gain. So thanks for listening.